The CDC is pushing double masks and vaccines. It is crazy. California has the most deaths of the country, supposedly. There are concerns about elderly people dying after getting the vaccine who've recovered from COVID. So it's concerning. And there are mutations being pushed by the UK that are resistant to the vaccine. Oh, we're talking about the Chinese virus, right? And many variants of them. And are we going to be reopening schools soon? Biden is not very aggressive in his plans. It's ridiculous. This is the end of hour one of the Jesse Lee Peterson Show. It is Thursday, February 11th, 2021. Stay tuned for hour two. It is 6:55 a.m. here in Los Angeles. But first, Hake news, not fake news. The CDC recommends double masking in new guidelines with a surgical and a cloth combination. This is from the Epoch Times, as well as the far-left female-run outlet The Skim. Yesterday, the CDC released a new study affirming that double masking is better than just one mask. They claim a surgical and a cloth mask combination, surgical being the one to throw away, can block nearly 93% of cough particles. And a fully vaccinated people do not have to quarantine after being exposed to COVID. So claims the CDC. We'll see if they stick to that. But that's basically an underhanded way of pushing everybody to get vaccinated. That's according to the Epoch Times and also the Skim. The health agency, so-called, updated their guidelines saying fully vaccinated 2 shots, not just 1 shot, can skip quarantine if they've been exposed to an infected person. And PTSD, earlier this week, a UK study said that a third of COVID patients who were on a ventilator suffered post-traumatic stress disorder symptoms. The most common were flashbacks, thinking of images of the ICU room, intensive care unit room, doctors in personal protective equipment, masks and stuff, and ICU patients. And 1 in 5 who were just admitted to a hospital, not necessarily put on a ventilator, also reported symptoms of PTSD, traumatized by the scaremongering mess. Stay away from the hospital, guys, right? The study's raising awareness about the need for mental health services for COVID survivors who may experience short or long-term effects. And drama over the deaths. California surpasses New York as the U.S. state with the most COVID-19 deaths, according to the Epoch Times. As of Tuesday, more than 45,000 people have supposedly died of this Chinese/commie virus in California, the most populous of the 50 states. 40 million people here, supposedly. New York had 44,693 lives lost, according to the far-left Reuters total. Dr. Mark Ghali, G-H-A-L-Y, California quote-unquote health secretary, emailed Reuters saying, "This is a heart-wrenching reminder that COVID-19 is a deadly virus, and we mourn alongside every Californian who has suffered the tragic loss of a loved one during this pandemic." Sounds like he's trying to convince us. Per capita, California had 113 deaths per 100,000 people, ranking 32nd in the nation in terms of the COVID mortality. Presumably, that's those of people who caught it versus those who died. I don't know. It's weird. And 230 deaths per 100,000 in New York, ranking second only to New Jersey, 248 corona deaths per 100,000 residents. I don't know. It's confusing. And vaccines, deaths of elderly who have recovered from COVID but died after the vaccine, they raised some questions. This is an Epoch Times article by the great Cheryl Atkinson, who's been on the Jesse Lee Peterson Show some years back. 2 small clusters of deaths after COVID vaccinations have been reported among nursing homes in Kentucky and Arkansas. In Kentucky, 4 seniors died the same day of their vaccination, December 30th, 2020. 3 of the 4 who passed away reportedly already had coronavirus prior to getting vaccinated. In Arkansas, 4 seniors died at a long-term care facility about a week after their vaccination. All tested positive for COVID after their vaccination. The deaths are reported in federal databases called VAERS, V-A-E-R-S, Vaccine Adverse Event Reporting System. Not sure what's to blame, right? Because these people are old and frail, and so we don't know if it's related to the vaccine or not. I'm James Hake.